Hi, everybody. I am Trish Hall, Senior Client Success Manager for the West region of the country. I support our sites in VISN 22 and in VISN 21. And I'm super excited. We had 4 new VA partners in 2020 fiscal year 2023 who implemented their Get Well technology, and they have seen some amazing impact on their fall prevention activities by leveraging their Get Well technology. I'm going to share some of that with you guys today. So, of course, when we start working with our new sites, we kind of align the content on the Get Well system with their outcome goals that they want to make improvements in certain areas. Of course, almost always one of those safety goals is reducing falls. So all 4 of our VAs that went live incorporated Get Well content in their Get Well system as one of their solutions for educating, engaging the veterans in their efforts to reduce their falls. The fall prevention content that was added at all the sites were fall prevention education as part of the essential education that the veterans are required to watch upon admission. In addition to that, we have their fall prevention pathway that launches a few hours after admission that also kind of raises the awareness of different fall risk factors that we want the veterans to be aware of when they're in the hospital, and also additional fall prevention education. And then the third feature that we have in place is the Call Don't Fall prompts. There's a little image of one over there on the right. These appear on a regular schedule on the Veterans TV. Once again, keeping the awareness of fall prevention front and center during the veteran's stay. So just by implementing these basic features that I'm sure a lot of you have in place, these 4 VAs in their first quarters of being live with Get Well have reduced their fall rates overall by 33%. This actually equates to a cost avoidance of over $5.5 million. I'll go over a little bit how we come up with those numbers when I start featuring the individual sites. One thing I definitely want to point out, though, is we know that this is not all just because of implementing Get Well. We have amazing teams at all the facilities who are working on different ways to reduce falls and increase fall prevention education and awareness. So definitely we consider Get Well a valuable tool using the technology in those efforts, but they definitely have a lot of other interventions and activities going in place to prevent falls. Okay. So our first site, VISN 21 site to go live in 2023 is the Ionis Lugares VA Medical Center. They're in Reno, Nevada, 124 beds. One of the outstanding features that when I first started working with this facility is they were already very high performers in their veteran experience and clinical outcomes. So when we start working with a brand new site where we're building their initial content, we usually look at where they might be underperforming, and we might be able to add content that will help them achieve their goals. And it was a little challenging because they were performing so well. But of course, fall prevention, always an area we want to do better in for every facility. And we did incorporate that content in their system for their go live, which was in December of 2022. So they implemented Get Well technology in Q1 of 23. And since then, their results have been very impressive. Since implementing Get Well content, they have had a 41% decrease in their overall fall rates. You can see that as their increase of the fall prevention video education completion has gone up, they've had a very consistent downward trend in their fall rates at the facility. I don't have on this graph the way that we calculate the decrease in the fall rates is we use a baseline. So what was the number of falls prior to implementing Get Well? So for them, their fall rate prior to Get Well was 14. So we kind of extrapolate that if that fall rate had remained steady, how many falls would have been expected. And then we compare that to the, sorry, I'm messing with my teeth. They compare that to the actual fall rate. So they were actually able to prevent 23 falls by their many efforts and utilizing their Get Well technology. And for me, as a clinician, that's the part that I think is most important. That's 23 veterans who didn't have a complication, probably didn't have an extended treatment or prolonged length of stay because they avoided the falls while they were at the facility. Of course, there is a definite cost advantage to preventing falls, and the way that we calculate that, we use a Journal of American Medical Association article that's referenced down in the bottom left-hand corner that delineates an average cost of the fall in the United States is $62,521. So that's how we come up with the amount of cost that was avoided by reducing the falls, besides the obvious, more important clinical outcome of improving the safety for the veterans. And the next site to go live was Palo Alto VA Medical Center. This is a huge facility, 600 beds. They have 3 campuses, 2 of them are nursing homes, and then the main campus that's pictured here is their acute care and specialty care units, and with an additional of 1 other nursing home. It is the largest integrated healthcare system in the VA in terms of specialized programs, research, graduate medical education. Something that really stood out for me for the Palo Alto is they have a lot of specialty units. They are really subject matter experts and resources to other VA facilities for their work that they do in polytrauma, spinal cord unit, blind rehab, and all of their specialty areas are a resource and example for VAs across the country. So they went live with Get Well in April of 2023, so they came in on Q3 of that year. And since then, they have achieved a 30% decrease in their overall fall rate. Once again, their increase in education completed is aligned with their downward trend in falls. The one thing to note that I think is a good to highlight for this site is in November of last year, they reviewed and revised their fall prevention content. And I want to call that out because I know probably a lot of people on this webinar have had some of this content in place for a while. And we always advise that it's really valuable to go back and review what content you have in place and revise, make sure that it's relevant and valuable for what's going on with your facility at the time. The Palo Alto did change up some of the education that they're providing to the veterans about fall prevention. So we're hoping to see them continue that downward trend going forward. So they had 35 falls prevented for that 30% reduction in falls at their facility over those 3 quarters that they've been live with the system. And we can move on to the next one is San Francisco VA Medical Center. They went live in June of 2023. As you can see from this picture, really beautiful, beautiful campus in San Francisco, up on the hill overlooking the bay and the Golden Gate Bridge. It's if you ever get a chance, go check out that facility. It's very impressive sites there. They are the largest competitively funded research program in the VA. So they have a lot of researchers and a lot of projects going on at that facility. They, as I said, went live in June of 2023, so came in towards the end of Q3. And since then, they have seen a 23% decrease in their overall fall rate since they have implemented their Get Well technology. Just a little bit of a call out for them. The week after we went live with their Get Well system, they started their Vocera implementation, which is, as many of you know, a huge project. So it did kind of take a little bit of attention away. Usually when we go live at a new site, we follow up with a lot of activities to increase engagement and awareness with the staff, but they had to focus on the Vocera. Even with that, though, they've achieved that 23% decrease, and we just recently went back and did some more education, started engaging the staff, so we really anticipate seeing them even see more benefit from their education and system going forward. They achieved 15 falls prevented to lead to that 23% decrease. And our final, fourth, VISN 21 logo to go live last year was the North Las Vegas VA Medical Center. 140 acute beds and a 40-bed substance abuse and gambling treatment program. This facility was dedicated in 2012, a whole brand new hospital. It was the first VA medical center built in 19 years. I've been working with Get Well for 10 years, and I can say just about every VA that I have visited is an older building that has been updated and added on. Sometimes it's like a maze, finding your way around because of all the additions that have gone on through the years. But this facility is very impressive. It's just brand new, open, airy. It's a very impressive facility. So once again, if you're in Vegas, swing by and check out their beautiful crown jewel VA. So they also went live, yes, a week after San Francisco. We brought the Vegas VA up live with their Get Well system. And their results are also super impressive. They've had a 48% decrease in their overall fall rate since going live with the Get Well system. So once again, increasing that awareness of fall prevention and the education with the veterans, hopefully making a big positive impact on their outcomes. They had 20 falls prevented to reach that 48% reduction in falls. So overall, for the new sites in VISN 21, there were 93 falls avoided in fiscal year 2023. I do want to give out a call out to our very first VISN 21 facility was the Northern California VA, which is their main campus facilities in Sacramento with the CLC out in Martinez. They've had Get Well for about 3 years. I didn't highlight them on this presentation because we were looking at the brand new sites that came on board, but they also achieved a 26% reduction in falls in fiscal year 2023. So once again, their team's doing great work, and that equated to an additional 12 falls prevented. So that was 105 falls avoided for the VISN for the past year. So looking forward, as I mentioned with the Palo Alto site, we always want our sites to be reviewing and revising and updating their content. So I just wanted to share a couple of a few new features that we have available for sites to consider if you haven't already. The first one is our fall prevention screensavers. With our new UX, we now have the ability to put screensavers on so that if the TV is on and idle for a period of time, these screensavers come up just as they would on a computer. And it's a really great opportunity to highlight information, education programs with the screensavers on those TVs. This is 3 examples of screensavers that some of our sites have created and put in place. Of course, the fall prevention screensavers are a very popular and helpful feature to add to your system. This is a screensaver that was created by the San Juan, Puerto Rico VA and shared with us. It's not specific to fall prevention, but I thought it was a valuable tool because it's highlighting the advantages of having friends and family present when you're admitted into the hospital. So as you can see, there's obviously a lot of advantages if a veteran is able to have some friends and family spend time with them when they're in the facility. And of course, one of those many advantages is the probability of reducing falls by having someone there to either assist you or assist with getting help when it's needed. So wanted to share that from San Juan. This is a feature that I believe was already presented on a few previous community of practice, but I think it's a really great feature for sites to consider. And this is a call don't fall acknowledgement that appears at the end of essential education. So once the veterans have completed their initial video safety education, this disclaimer comes up and it requires the veteran to acknowledge it in order to continue on to use the other features and functions on their television. And I think there's a lot of value in them having to actively acknowledge or press the continue button that that they have to at least look at that screen at one point when they're first admitted. Sioux Falls created this, and they also have it set up so it documents back into the EHR when the veteran acknowledges the safety disclaimer. So you do have that documentation in place that the education was provided upon admission. And my last content to share was created by the Orlando VA Medical Center, and they added this fall prevention tip sheet to their Get Well system. In addition to that, they added a prompt that invites the veterans to view their tip sheet, and on it, it talks about them having a personalized fall prevention plan. This poster that is on here is in the patient room, so it's reinforcing a tool that's being used at the bedside by highlighting the poster that shows that the veteran's individual fall risk and which fall interventions they should be leveraging while they're admitted to the facility. It also has a little bit of great information about why fall prevention is important and making sure that their length of stay and treatment isn't prolonged by a fall. And the veteran gets prompted daily until they view the tip sheet. Once they have viewed the tip sheet, then they don't get prompted anymore. But I especially like when our facilities use the Get Well technology to highlight another tool that's also in use, so it all kind of combines together into one message for the veteran. And I think that's it for me. there's my email if you have any questions, or if you have an interest in talking to any of